Hi, everyone. Again, my name is Antonius Minifield, and I'm a person of monkeypox experience. Oh my God, what a ride. However, but some people may know me for my work in HIV service agencies in Atlanta, as well as He's Value. Thank you.
Thank you so much for being here, Antonius. So just to give everyone a sense of where the roadmap for tonight's conversation, we'll start out with a presentation from Dr. Thompson, and it's also some comments from Dr. Folks. Then we'll have some remarks from Joshua to kind of give us an update on where things stand here in Fulton County and sort of Metro Atlanta kind of more broadly. And then Antonius will share a little bit about his experience, and then we'll open up the floor for question and answer. We know that you might have questions throughout the presentation, and so what we ask is that if you're following us on Zoom or on Facebook, that you can put your question. If you're on Zoom, we ask that you use the Q&A box, which is located at the bottom of your screen, rather than the chat. So use the Q&A to ask questions. If you want to have conversation in the chat, that's totally fine. On Facebook, I believe we can also elevate your questions from if you put them in the chat on Facebook. So yeah, please use the Q&A if you have specific questions for any of our panelists. And I believe that's the only kind of bit of housekeeping. So we'll have presentations, and then we'll have a call to action from our colleagues at Georgia Equality, which is also very, very important. So with that, I'm going to turn the floor over to my esteemed colleague, Dr. Melanie Thompson. Dr. Thompson, the floor is yours.
Awesome. All right. So let me share my screen here. And we are going to do kind of a high-level monkeypox update. And I'm going to go through a lot of material fairly quickly, but we will figure out some way to make the slides available for folks. So don't worry about that. So this is going to be a high-level update. We're going to talk about what monkeypox is, how you get it, how do you know if you have it, prevention, treatment, and then, let's have some discussion about what should we be doing as a community. So first of all, what is it? So monkeypox is a cousin of smallpox, the orthopox virus genus, and that's the end of the microbiome.
Dr. Thompson?
Yeah.
Your slides aren't advancing, so we're not seeing it in the presentation mode. So
okay,
you might have to back out and go back in.
That's a little bit of a problem. So let's see where we are with this.
Perfect.
You can see that one?
Thank you. Yeah.
Can you see?
Yep. There we go.
Different slide? Okay. All right.
We're all good. Thank you so much.
Okay. So I kind of hit the highlights of this. Let's talk about what monkeypox is. Cousin of smallpox in the orthopox virus genus. It was originally seen in monkeys, surprisingly. It is endemic in 9 to 12 African countries. It was discovered in humans in 1970 in Congo, but it is most common now in Africa, in Nigeria. And there are two types of monkeypox, two clades. The West African.
Excuse me. There's people in the chat saying that they cannot see the screen and they just see us spinning the wheel. Okay, now that they can see it, my apologies.
Can everybody see the screen? I'm sorry, I can't have the chat up and the, the slides at the same time. I see a lot of thumbs up though. All right, keep those coming. Thumbs up, yay. Okay, so two types, we call them clades of monkeypox. The West African is less severe, causes less severe illness, has less than a 1% fatality rate in Africa. Congo clade causes more severe illness. And the good news is outside of Africa, it is all West African type virus. And there have been no deaths from monkeypox so far that we know of. Now, monkeypox was first seen in the US back in 2003, transmitted from African rodents and pet prairie dogs. Who knew? Here's a map of the European region. Where is monkeypox? Well, it's pretty much all over. It is reported in over 60 non-African countries. There are about 15,000 non-African cases. That was as of yesterday, about half in Europe. In the US has 2,323 cases as of yesterday. And here is what the US monkeypox map looks like, almost all states. This was up to date as of yesterday. It changes every day. 158 cases in Georgia, making us fifth in cases in the whole country, but we are third among states if you take into account our population. Now, I'm not going to talk about the local numbers for monkeypox or the demographics, which are very, very important, but Josh is really going to drill into those. Okay, so how do you get it? Well, monkeypox is mostly skin-to-skin transmission. And that's why sex is so efficient. You have to have contact with the lesions, but it also could be lesions that are in the mouth. And monkeypox virus can be transmitted through saliva if somebody has lesions in their mouth. And anal and rectal sores can transmit during sex, and probably sores in the vagina or front hole also. We don't really have data about that, but you would imagine that would be true. Now, it can be transmitted by large respiratory droplets with really close face-to-face contact, so like sneezing or coughing, really close face-to-face. But this is not aerosol transmission. It's not airborne the way COVID is. So it's not that easy to get from that mode of transmission. However, with monkeypox, contaminated materials like bedding and clothing and towels, eating utensils may hold live virus for a couple of weeks. Fabric is more likely to do it than plastic or metal or glass. But the good news is that it is very susceptible to being killed by bleach or disinfectant wipes like Clorox or Lysol. I mentioned those brands because the EPA actually has a list of approved disinfectants, but those will work well. Now, people are infectious while their lesions are present, and that can be for 2 to 4 weeks. And really important that even those scabbed lesions contain virus, so we have to wait for the scabs to fall off and the skin underneath to heal. And here's a little point. Other mammals can be infected by monkeypox, dogs and cats. So if you happen to have monkeypox, maybe don't pet your dog. We don't know whether they can transmit to humans, but it's a possibility. All right, so how do I know if I have it? So the incubation period is about a week to 3 weeks. There's this sort of typical prodrome of symptoms. Now, not everybody has these, but the typical thing would be fever, muscle aches, backaches, headaches, lack of energy. One patient said, hey, I thought I had COVID, so I test myself for COVID. Swollen lymph nodes are common and they're sort of unusual for COVID. But then usually the rash comes along. Now we'll talk about that in just a minute. So monkeypox can be more severe in children or pregnant persons or people with immune suppression due to a variety of health conditions. And we think probably people with HIV who have a low CD4 count and have uncontrolled virus may be at higher risk for severe disease. But remember, people with monkeypox also may have sexually transmitted infections, syphilis, chlamydia, gonorrhea, herpes simplex. So these have to be considered. Now, what about that rash? So it usually begins a few days after fever. If fever occurs and lasts 2 to 4 weeks, it may begin on the face or other parts of the body, the arms or the legs, as well as in the genital or anorectal area. And this rash evolves. So you may see different kinds of lesions all over the body. They may start out flat or pimply, become blistery, and then filled with pus, and then they scab over, and eventually they dry up and they fall off. And only after they fall off and there's healthy skin below is it non-infectious. Now, as I mentioned, they can be in mucous membranes. That's very important. So how do you test for monkeypox? Well, you have to swab a lesion. There is no blood test, no point of care rapid test right now. You just have to swab a lesion. A healthcare professional must use full PPE, so personal protective equipment. That's a high quality mask, gloves, gown, eye protection. I was just garbed like this about a half hour ago. Tests can be sent to the Georgia Department of Public Health. The good thing is those are free. The bad thing is it's very cumbersome. The paperwork is very intensive. And so we're happy that commercial labs now are doing monkeypox testing. It's not free, but it can be billed to insurance, but there is a risk of out-of-pocket costs. And now we're seeing a swab shortage. And some of you may remember early COVID when we had this problem with not having swabs. Just a reminder to ask for or offer STI testing also. So it's not just about monkeypox. Now, how can it be prevented? Well, to prevent infection, you don't want to come into contact with the virus. So to avoid close skin-to-skin contact with people who have a rash that looks like monkeypox. And I think you could see from the pictures that those lesions can be totally benign looking initially, like a little red dot or a pimple. So you shouldn't touch any rash or scabs of a person with monkeypox. That probably goes without saying, right? But unfortunately, if somebody has monkeypox, kissing, hugging, cuddling, in addition to sex, can be risky. And also in terms of sharing utensils or cups or whatever in a household, that shouldn't happen. It's important not to touch bedding, towels, clothing of someone with monkeypox without protection, and to wash your hands often with soap and water or use an alcohol-based hand sanitizer. And this is a slide that I'm not going to read to you, but it has some tips about caring for a person with monkeypox in the household. And as I said, we'll figure out how to make these slides available. Now, public health containment is really important to try to contain monkeypox, keep it from spreading. Testing is important. If sores are present, go get tested. And isolate until the test returns and is negative. If the test is positive, or if for some reason you can't be tested, isolate until the lesions have entirely cleared. That usually takes 3 to 4 weeks. And I know this creates huge problems, and let's talk about that later. Contact tracing is important. So please inform your partners immediately and share contact information with public health. They will not use your name, but they will notify people that they have been exposed so that they could be vaccinated, or to let people know that they might have monkeypox and not know it. So what about vaccination? Now, Joshua is going to talk more about Fulton County's vaccination plan. So at the high level, basically smallpox vaccines can protect against monkeypox up to about 85%, particularly if it's a fairly recent vaccination. The 2 types of monkeypox vaccine that exist are the Jynneos and the ACAM 2000. The Jynneos is the one that we're using. It requires 2 doses in 28 days, over 28 days. And it is safe for people with HIV and other immune conditions. And that's why we use it, because it is a non-replicating virus. Now, the ACAM, it's the old smallpox vaccine. It's plenty effective, it works, but it is a live virus vaccine, and we don't want to give that to people who may have immune conditions, including HIV, but also people who may have eczema or atopic dermatitis. Also has a potential for more side effects. Now, this vaccine can be given before exposure to prevent infection, or early after exposure to prevent or lessen disease severity. So that's like post-exposure prophylaxis, like PEP that we do for HIV. So currently the vaccines are in short supply. I think most people know that. And they're often being prioritized for the contacts of people, for PEP, and also for gay and bisexual men, potentially transgender individuals as well, who have had at least 2 partners in 14 days. And Joshua can tell us if that is changing anytime soon. So how about treatment? Well, there is a treatment that is being used for monkeypox. It is not approved by the FDA for monkeypox. It is available only from CDC for people who qualify. Any medical provider can request the drug. There is a good bit of paperwork, but I have to say, CDC is listening to us, and they have worked to simplify this so it is not as cumbersome as it was even a week ago. This is an oral medicine that you take twice a day for 14 days. There also is an IV formulation for people who are sicker. And the criteria that are listed on the CDC website include people with severe disease, people who may be at high risk of severe disease, and people with HIV sort of fall under that bucket. There's no CD4 requirement. Of course, we're more worried about people with low CD4 counts or high viral loads. But also, we're concerned about people who have an infection that includes their eyes, their mouth, their genitals, the anus, or the rectum, because these can really cause significant complications and really, really painful complications. So these are some of the requirements for TPOXX. Tecovirimat is the name of the treatment, but we call it TPOXX. Now, last, I want to end just by kicking some ideas off about what should we be doing as a community. And, big kudos to the organizers of this event, because we really need more education for community, but also for care providers. We need a one-stop shop for information about access to testing, access to vaccines, and also other information about monkeypox. And I think we're going to see that coming, and maybe Joshua can tell us more about that. It's really important that we ensure equity in this fight. We've kind of failed on that repeatedly, but this is another instance where equity is absolutely crucial, fighting stigma, absolutely crucial. And so advocacy is needed. And I'd love to hear your ideas about advocacy. Here are some thoughts from me that we have to have demographics, we have to have data to ensure equity. And we need to see this at the level of CDC, the Georgia Department of Public Health, the county health dashboards. We have to know what we're dealing with here, who's being affected. And then we also have to have information about vaccine distribution to be sure that those vaccines are getting to the people who need them the most. We need demographics by race. We need HIV status. And so these are very important. It is really important that we advocate to have no out-of-pocket costs for testing from the commercial labs. If you have a big fat deductible, then some of you may have gotten some bills from labs for things that aren't paid for. We don't want that to happen with monkeypox because we want people to get tested. We need more vaccines, and they are coming. And CDC is working very, very hard on that. Right now, the vaccines come from the Strategic National Stockpile and go to the health departments, but there will be vaccines that are coming to clinics. We want to work very hard to make these available in Ryan White clinics as much as possible. We need new money for additional workforce. Our workforce is depleted from COVID, and we really need more people to be able to work on this. And more support for Ryan White clinics. And then I have to say, you're asking people to isolate for 3 or 4 weeks. We have to provide government subsidies to allow people to stay home and isolate and not go to work, and ensure that people don't lose their jobs because they are home with an illness. So that's the beginning of my soapbox. I have more. You guys know me, I always have a soapbox. But let's continue to talk about this. Please please email me if you are experiencing problems. I want to learn about what the obstacles are in our community so we can work together to solve them. And so here are a few resources that you might use. And I will just end there and say thanks.
Thank you so much, Dr. Thompson, for a really excellent overview. I'm now going to turn the floor over to Dr. Folks, who also have a couple of comments to offer. Dr. Folks, the floor is yours.
Hi, good evening. I am Dr. Folks. I am associated with Thrive SS. I'm the Community Health Outreach Manager, and I do have a few considerations that we want to take into account when we're talking about monkeypox, particularly when we are looking at our communities of color and the LGBTQIA+ community. So I'm gonna be sharing my screen with a couple of slides just to discuss some of these key issues. Just get that ready. Okay, here we go. Can everyone see my screen?
You're still in slide, you're not in presentation mode yet.
Oh, okay.
There you are.
Presentation mode? All right. So
now you're all set.
Great. So thank you, Dr. Thompson, for touching so much on some of these topics so far, such as where did it come from, but also one of the main concerns, because we're seeing monkeypox so frequently appearing in persons who belong to the LGBTQIA+ community, there's the question, is this a gay disease? And why is it spreading within our communities? Also, a big concern is, what does this mean for people who are living with HIV? And particularly when we look at persons of color, one of the main concerns is how safe and effective are vaccines, because we do live in a country that has a history of a lot of medical mistrust. And so these are rightly some concerns that persons may have. One of the things I do want to touch on, though, is that when we're looking at images of monkeypox, which are some of these images shown here, we do want to be very careful about how we're representing monkeypox in the media. I do know that in a number of countries, the issue of monkeypox has severely raised a lot of racial tensions, particularly because a lot of the images that are used to display monkeypox are images of persons who are melanated, persons of color. And so we want to make sure that everyone is aware that this is not a disease that is strictly restricted to the Black community, but it may also appear in persons who are not melanated and Caucasian persons. We also need to make persons aware that these severe images, I'm not sure if you can see my mouse pointer, but these severe images, for example, the one on the top left, are not necessarily the presentations that we are seeing currently. We are seeing presentations that may look more like the image on our bottom left. Or is that right? That's right. I'm so sorry. We're seeing less severe presentations where it may not necessarily be as disseminated. And so we have to be very vigilant where we're looking for information or cueing off the fact that historically monkeypox has presented like this in other communities, in other regions, because really and truly monkeypox is presenting in a new region geographically and also a new community demographically. And so we have to be very aware that the presentation may look different. And of course, being aware that monkeypox, again, is not restricted solely to persons who are melanated, but it may also appear in Caucasians, as we can see in some of the images shown here. So looking at a few of the key points, as Dr. Thompson had mentioned, monkeypox is definitely not a new disease. It's endemic to the Democratic Republic of Congo and a few other countries which are found in Western and Central Africa. And as she said, it's more prevalent in Nigeria, but there have been occasional outbreaks to other regions, including the US in 2003. So we know where it comes from, and this is not a new issue that we're dealing with. So it's not the same level of alarm as COVID-19 because there is a plan. There are treatments which are readily available to tackle monkeypox. It may not necessarily be in the largest supply at the moment, but there are treatments available. Monkeypox is not exclusively associated with persons who identify as gay or bisexual. However, it has been prevalent in this 2022 monkeypox outbreaks. And this may be likely attributed to our social behaviors, just how persons who identify as gay or bisexual may interact with one another. There's a lot more frequent touch, but also we need to be aware that, thank you, Joshua, for providing me with some of the language to describe this, but monkeypox may be sexually transmissible, but not necessarily sexually transmitted. That is to say that monkeypox, sex most certainly facilitates the transfer of monkeypox, but it doesn't necessarily cause the transmission of monkeypox through the exchange of body fluids or through ejaculation. Studies so far have shown that monkeypox is not necessarily present in vaginal or seminal fluid. This is a new outbreak. We don't know enough yet to say that it's not necessarily present in this case, but historically, based on the information that we have before, we know that it has not been found in vaginal or seminal fluid. But sex most certainly does act as a vehicle that facilitates the transmission of monkeypox. So we must be aware of that. Also, when we're looking at persons who are living with HIV, this is absolutely essential. Viral suppression is very important for persons who are living with HIV for effective prevention and to avoid the complications of monkeypox. Persons who may not be on their medications, persons who are out of care, persons who are not aware of their HIV diagnosis may be particularly at risk, not only for contracting monkeypox, but also developing severe disease. And so we have to be very aware of our HIV statuses. We have to ensure that we're testing. We have to ensure that if we are aware of our status, if we do know that we are living with HIV, we are taking our medications and we are ensuring that we are virally suppressed, not solely because of the preventative action of monkeypox, but on the topic of vaccines, even though we're seeing where the Jynneos vaccine is much safer than the ACAM option for persons who are living with, we also need to be aware that if you do have a compromised immune system, it may not elicit the same level of response. So for lack of a better word, the vaccine may not necessarily take or elicit that immune response that we want to be elicited with a vaccine. So even though it is safe, the Jynneos vaccine is a non-replicating vaccine. There's no risk for infection from that live virus. There is the importance of viral suppression in that regard. And as Dr. Thompson had mentioned, vaccination is about 85% effective in preventing monkeypox, and is also effective in also reducing the symptoms and preventing complications. Vaccines may be given before or after exposure to monkeypox. In the case of pre-exposure, it may prevent monkeypox, but in the case of post-exposure, if you're exposed within a window of about 1 to 4 days, you may receive the vaccine in order to prevent infection. But of course, if you stretch that out to about 14 days, you may get the vaccine in order to prevent that severe disease and prevent some of the complications that may come with monkeypox. So of course, vaccination is essential. And it's important to note that these vaccines are not new. These vaccines, even though this is a third generation type of vaccine, the vaccine which is prevalent, the Jynneos vaccine, it is something that is safe. These vaccines are responsible for eradicating smallpox, which is the only disease in all of human history that has been successfully eradicated. So we are aware that these vaccines do their job. They are entirely safe. And it's important to get vaccinated, not just for oneself, but also for the persons around us, not necessarily just for protection and just to prevent the spread, but we also need to lead by example. We need to understand that as community leaders, as persons who are aware of this risk, we are doing our part and our social responsibility to ensure that we get vaccinated, because this is one of the main ways that we can detain this infection. So I think those are some of the main key points to take. And thank you so much, Dr. Thompson, for presenting that lovely presentation. You really covered a lot of the points that were necessary to be covered. And thank you for providing us with that information. And Joshua is going to share with us a little bit more information on vaccinations, vaccination safety, and a little bit more of the epidata that we need to talk about when we're talking about monkeypox currently in this 2022 outbreak. Thank you.
Thank you so much, Dr. Folks. That was great. Joshua, I think we'll wait for Dr. Folks to take his slides down, and then you will have the floor.
Thanks, Justin, and thanks, Dr. Folks. We appreciate that. Hi again, everyone. Again, my name is Joshua. I lead the efforts at Fulton County Board of Health, and I want to start by introducing myself a little bit further, just to give you context on who I am and who is responsible for helping lead. Of course, I have a lot of colleagues, and several of us are queer as we're leading these efforts. I identify as a queer, kinky, poly, sex positive activist. I come from San Francisco. I've been living in Atlanta for 2 years. I come from a community-based side, so this is my first, not first, but my leadership opportunities in state systems like this. And I have a bit of a different approach, and I'm excited to be present and contribute the sort of history that I have in the ways that we're moving forward at Fulton County. What that looks like is we're trying to avoid fear-based messaging when it comes to monkeypox. We're trying to embrace sex and sexuality to try to achieve sexual health and not try to police people's sexuality here. So I think the ways in which we talk about this is really important with our peers, lovers, and friends. I also think it's really important to try to decrease the amount of stigma that's happening with monkeypox and recognize that though this is not a gay disease, I mean, it's very similar to the same sort of narratives around HIV, but I do want to recognize that in Fulton County, and especially in the state of Georgia, that almost all that I've heard so far are amongst men that have sex with men. And so I want to recognize that that's where our efforts are going in order to ensure that we're keeping this contained, though it's only a matter of time before this also impacts other communities. And so this is our opportunity to try to get in front of it as much as possible. And I'll talk a little bit about how we're doing so. But what I really want to do is also recognize all of the frustrations in the room. And it is okay to be frustrated. In fact, I'm really angry about this situation. I feel helpless. I am doing everything I can in my power. All of the team that I'm working with, we're showing up really hard. We're working long days. We're working 6 days a week. We've shifted schedules to try to do the same thing. And we're doing the best that we can with the tools that we have. And in fact, we're very open to feedback from other people's experiences so we can improve our efforts. And I'll tell you a little bit about what that looks like and the changes that we've made already. We've only been activated for the last 2 weeks in monkeypox here at the Public Health Department. Though this was on our radar, it really hasn't been up until recently that we've been distributing these vaccines. And I will talk a little bit through that. But I think finally, beyond the frustrations, which again, speak your mind, it's okay. If you're not angry, then you are not queer or you're not paying attention. And we want to activate our communities and ensure that we're showing up hard, but also that we're putting our energies in a way that is going to increase our access and our health as a community. The spaces like this are a great example. This is spaces coordinated and facilitated by queer people who are working outside of work to come together to ensure that our community has access to information and the resources that they need. So thanks for everybody for being here. And I want to talk also about accountability. The reality is all institutions, especially from the state, are going to make mistakes, and that's real. I will own those mistakes, and I will, even if they're not mine personally, if they're part of our agency, I'm here for accountability. And if there's ways, again, that we can make things right, then I am going to do my best to correct the situations and move forward in a graceful way. I want to start with epidemiology. This is important. It's essential. I have been fighting really hard to get up-to-date information. The CDC website is great because it gives snapshots of what are the new infection rates amongst all the states, but it's not enough. I've been refreshing because they're supposed to update every night at 5 o'clock, and we still don't have a new update. The last one from yesterday was 158 infections in the state of Georgia. The information that I'm going to share with you now is from Fulton County specifically, but it is reflective of what's happening throughout Georgia. I cannot cannot speak on behalf of the other counties. The counties, just so everybody in the room is clear, the way that epidemiology works, the way that we're collecting this data is every county is responsible for reporting all the cases within their counties. What happens is positive cases come to us. We call those cases to ensure they have access to treatment, ensure that we help get information to get a hold of their partners, to do contact tracing, as we all learned about during COVID, but many queer people know about before that, because contact tracing is not a new thing. I would say that historically, queer people's relationship with contact tracing is kind of complicated because it's tricky to try to divulge sexual health information and histories with people that you don't know from a public health department. But in this context, it's really important because those folks who we know were exposed to monkeypox will get post-exposure prophylaxis. So when someone is positive and you let us know those partners, we will get in contact with them and ensure that they have access to this vaccine. So also within that, that's how we come up with these demographics. We ask questions around your age, your race, and other kind of aspects of your being so that we can understand who is getting this infection and how we can prioritize those populations. And here we go. So I will say this is the most alarming part. As of Monday, the 18th, we in Fulton County had 56 reported monkeypox cases. And 3 days later, as of the 21st, we're at 106 cases of monkeypox. Of those cases, 63% of those cases are Black. And that needs to be called out again. 63% of those cases are Black men. That is a huge disparity, and we need to tackle that. There's 2% Asian, 6% Hispanic, and only 15% white. So it is very clear where the disparities lie amongst folks in communities of color, but specifically for Black men. Only 14% of these cases, we do not know the race. That's because folks test, and sometimes when they're accessing testing, they do not fill out the forms and the demographics. So again, 14% of these folks, we do not know their race. HIV status is also an essential part of this. So we're finding that 53% of the people who are getting monkeypox are HIV positive. That is a huge disparity right there. And we need to ensure that people living with HIV not only have access to treatment and care and services, but also are centered in the ways in which we're prioritizing people because folks with HIV may or may not be in care, may or may not have a suppressed viral load, may have compromised immune systems, and monkeypox could impact them more intensely. We're still doing some digging and some sort of investigation to figure out, I don't like the word investigation, so my apologies for using it, but really trying to figure out what are the impacts of monkeypox with people living with HIV. So, but again, calling that out, 53% of people that have monkeypox in Fulton County are HIV positive. And of the people who are living with HIV that are diagnosed, 80% of those people are Black. So it's very clear who are the people that are being most impacted by monkeypox. And it is our responsibility to ensure that those folks are the ones that we're reaching out to and engaging in the ways in which we are providing vaccines, outreach, education, and information. So we are activating the CBOs and community partners, people within communities that are throwing events for these communities, people that are creating spaces, especially sexual spaces. I can tell you that there are certain places within Fulton County that we're seeing overlaps. So there's like circuit communities, there's certain events, there are certain sexual and social networks where we're seeing a lot of monkeypox, and those networks are also ones that we're trying to tap into. I would say the folks that also have disparities, of course, language disparities for folks that are immigrants that don't speak English, Latinx folks that don't have access to services or that may be undocumented. We're talking about people that have a relationship with substances. These are all sort of overlapping in the ways in which they create sexual health disparities in communities. This is the same thing with monkeypox, right? It's a sexual health disparity, and it is impacting similar people. Let's see. Next, I'm going to talk about the vaccine pipeline. That's what I think most people are really interested in. First and foremost, it is very hard to get a vaccine appointment. I totally recognize that. The last one that we opened last night, we had 300 vaccine slots, and in 4 minutes, all 300 of those closed down. I did get feedback from folks on ways that we can increase our equity when it comes to vaccine registration. So I'll let you know some of the things that we're doing, which is posting the times that we're going to be posting the vaccine registration to give people a heads up of when that's going to happen, opening registration after work hours so that it makes it easier for people to register, having vaccine not just on Saturdays, but having them on the weekends so people can attend them on the weekends, but also having them on weekdays as well so that we can ensure that everybody is able to make it. Again, we are working with community-based organizations who serve, especially Black folks, especially people living with HIV. We want to make sure if 63% of the people are Black that are getting monkeypox, then 63% of the people who who are getting the vaccine should be reflective of the people who are getting monkeypox. Same with people living with HIV. So it is really intentional. I have recognized that sometimes these registrations pass along social networks in Instagram, for example, and that's great. I love that we're looking out for each other and ensuring people that we care about, our friends, lovers, and peers are getting access to this registration. But you should not have to have an Instagram account in order to get access to this registration, right? And so we're doing different ways of ensuring that people have registration. To give you an idea of the way that the vaccine pipeline works is we in the United States have had a limited amount of vaccines distributed. I think there was 59,000 vaccines distributed throughout the United States this week alone. Georgia up until now has only received 3,300 of those vaccines. There are other states that will get quite a lot. So New York, California, 30,000 plus vaccines. And so we are working to try to ensure that we are getting the vaccines that we need in order to be on top of this. As was stated before, we are about 5th in the nation as far as monkeypox cases, and I think Dr. Thompson said 3rd in terms of our population. We are getting more doses this week, in fact tomorrow, and we will have a better idea when we get those doses, how many we're going to get and how we're going to distribute them. The way that they've been coming so far, we've had 2 weeks of experience with doses. We were told on Wednesday that we were going to get 300 or 200 doses the first week, and we had a 72-hour turnaround to get those into the arms of folks. So by Saturday, we did our first pop-up. Full transparency, that pop-up, we connected with networks that were impacted by monkeypox directly, social sexual networks, so that we could try to inhibit the forward transmission. That was not a very diverse group of people. So the second vaccine pop-up that we did, we ensured again that we were reaching Black folks, people living with HIV, people with a relationship with substances, and ensuring that they had access. Again, we found out on Wednesday we'd have 400 vaccines, and we opened those up to registration on Thursday, and within 25 minutes, those were filled. We had definitely a more diverse group of people that second pop-up, but also the pop-ups are not always the way to go. So we're also rolling out this week, starting today, we did 150 vaccine doses at Neighborhood Union, which is one of our Fulton County Board of Health locations. And at that place, we will do vaccines tomorrow and on Monday, maybe I think Tuesday, I forget what the days are offhand. Sorry, I'm on point right now. And I was not prepared for that. But I will say that moving forward, we're hoping to have Wednesdays, Thursdays, and Fridays every week at Neighborhood Union so that we have a consistent vaccination schedule. Once we know more vaccines are coming in and how many are coming in, then we will start activating other providers who are working within this community. We're going to work with community partners and CBOs to ensure this gets out. We're going to have more mass vaccination events. We already have 2 planned that are the follow-ups. So Jynneos and ACAM are the 2 vaccines that we use most commonly. The only one that's being rolled out in the state of Georgia is Jynneos, and that requires 2 shots. You're going to get 1 shot 4 weeks after your first one, and supposedly you're fully protected 2 weeks after your second shot. There are some districts like the state of New York that are only doing 1 shot for each of their folks in order to ensure that there's a bigger reach. We have to abide by CDC guidelines and state guidelines, and we haven't gotten to that point where we can just do 1 shot right now. So we're going to continue as the FDA is suggested with 2 shots. So on August the 6th will be a 1 month from our first vaccination event, and we will probably not only do a second shot for the first round of folks, but we will also include more people in that. August the 13th, we're also going to do the second round for the second group of folks going through, and we'll add more vaccines to that. Again, 800,000 vaccines are coming to the United States right now. And I would imagine that they're here already. And those are going to be distributed based on the disparities that exist amongst states. So I assume that we're going to get a pretty significant amount of vaccines coming through. And those vaccines will be distributed as quickly as possible through mostly Metro Atlanta, but also available through all of the state of Georgia. They're allocated by the disparities that exist in each one of the counties. We will see mass vax signups, and I would say as soon as next week, you will see more opportunities to sign up for these vaccination events. Keep pressuring folks. I mean, I think that it's important. We're going to talk a little bit about what it takes for us to show up and to ensure that we have access to these vaccines. I know that it's really frustrating to folks that can't get vaccinated. Until you get vaccinated, we can continue to do harm reduction practices. It's similar to COVID. You know, I would personally, I'm not going to suggest anything for anybody, but I will just give you ideas of things that I'm doing and some of my peers are doing, which is limiting the partners that I have currently to a couple of them that might be my favorites or that I'm closely connected to, maybe foregoing some of the sexual spaces that I was really excited to participate in this summer, or if I go to them, then taking a partner with me so I can participate in them, but also still limit my exposure, voyeuring and watching and not always participating. I think maybe I'm going to watch the ways in which I connect with partners. So there's maybe limit the ways in which I am having sex and experiences with them. So I think that there is also just ways in which we could practice harm reduction that work for you. And if you have questions about what that could look like, there's a lot of folks that we can put them in the chat. We're going to respond to all the questions. If not tonight, we're going to ensure that they're all answered and then posted on a website so that you can get those answers later. Other things that we have done to ensure access is that we are securing spots again for vaccines. Everybody, we're doing what's called post-exposure prophylaxis. So the vaccine does, I cannot speak as a clinician because I'm not a clinician in terms of the questions I'm getting in the chat. And also I'm just seeing some chats pop up. If you have harm reduction techniques and tactics that are working for you, please put them in the chat because this is the place to share them, right? This is the reason that we're all coming together. And I'm on point right now, so I can't think of all of the great ones, though as soon as I'm done with this, I will probably think of all of them. What was I going to say? Importance of testing. So there's two other things I want to talk about, which we need, if you have symptoms, we really want to encourage you to get tested because that's the only way we can know the scope of the impact of monkeypox currently. What's happening with the stigma is people now know about monkeypox. When they're starting to have outbreaks, they're ashamed. There's a lot of like self heaviness that people are experiencing and talking about and not wanting to be seen, the ways that other people respond, care providers who are uninformed. And so sometimes people are not seeking testing, but the testing numbers is how we confirm the amount of monkeypox that we see in our district. The other thing is important that I talked about was contact tracing. Please share your information with partners to let them know that they've been exposed. And please talk to our teams of epidemiologists who are conducting these interviews. Because again, when you share your partner's information with them, we ensure that folks that were exposed have access. So post-exposure prophylaxis is important. I can't speak to whether like the vaccine works after you're symptomatic, but I will say that after you've been exposed, we still provide the vaccine to folks to kind of hopefully minimize the impact of the virus. Though again, this is new for many of us, and so I think we're just seeing how this works as it's rolled out. And then PEP plus is this thing you're going to hear about, which is exposure prophylaxis that sort of post-exposure prophylaxis that sort of expanded beyond just someone who is a known contact, but people who have multiple partners in the last month, who have a relationship with substances, who participate in these sexual spaces, and who have monkeypox in their sexual and social networks, right? So with the limited amount of vaccine that we have, we're trying to be as intentional as possible to get in front of it because this is the only opportunity we have to try to like slow the transmission. And so that's where we're at. Unfortunately, we've just been working with what we have. So again, as far as numbers are concerned, Fulton County up until now has only had 600 vaccines to distribute. Today, with 150 extra, that's 750 vaccines that we've given out. Hopefully by the end or the middle of next week, we'll be at about 1,000 in Fulton County. That's still not enough. That's just a drop in the bucket. And we are working our hardest with state officials and the feds in order to secure the vaccines that we need in order to be on top of this. So again, your frustrations are totally valid. It's okay to be upset. I hope that we can use those frustrations in a way that works for us in the community to activate people who may think that we're invisible, who may not center us, but we need to continue supporting each other as a community and ensuring that we move through this as tactfully and intentionally as possible. So thanks, Justin. I'm open to questions when it's the Q&A part.
Thank you so much, Joshua. And just want to give you an extra shout out. We know that you are working incredibly hard. Your whole team there is really putting in a lot of work to try to work on behalf of our community. So I just want to offer you that appreciation. We see what you're doing. We know this is hard. Public health is not, we don't get into public health for fame and fortune. So thank you for your efforts. We see you and we appreciate the efforts that you're doing.
Thank you, Justin.
I'm now going to, thank you, Joshua. So now, Antonius, I want to bring you to the stage here. And I want to just kind of, first of all, how are you feeling? I mean, I just want to check in, like, how are you doing? It's been a while since I've seen you. So I know that, this can be difficult, but I just want to know, how are you doing?
So I know I'm smiling. For those who know me, I'm always going to try to keep a smile. However, today is one of those days where, y'all, I'm uncomfortable. I'm just going to be honest. So but I'm here. However, I'm here. I can say that I guess maybe I'm in the close to the end stages of it. But still, just to be going through some of the symptoms and the things that it causes, and of course to still be able to see what my body has went through, I'm like, okay, cool. I've been there, done that, but yeah, today has been an interesting day.
So I want to just kind of go through a little bit of your journey, and I'm wondering if you could tell us a little about sort of how long did it sort of take for your symptoms to show up, and sort of what were some of the first symptoms that you noticed?
So on July 7th, I already had a doctor's appointment, and I went to the doctor, and just, of course, he asked me if I had any, if I knew anything, if I had anything, if I felt like I need to get tested for anything. I did show him this mark that's still currently on my hand. However, at the time, it was very pustule-like, and he tested me for syphilis, and the syphilis actually came out negative. But that night, that was Thursday, early Friday morning, I woke up with chills, sweats, diarrhea, because if you have any other underlying issues, it's going to cause those to flare up. So my IBS flared up, and I just went into the restroom and turned on the lights, and all of a sudden I just saw marks, just marks everywhere. So it, as they said, it literally you can have one mark, and within 12 hours, your body will just, the whole body.
So you mentioned that you were already kind of, you already in care and you're going to your doctor already for testing. And I know for a lot of people, kind of getting tested is a challenge, and so we can kind of talk about that a little bit later. But beyond sort of the medical experience that you've had, what has it been like to kind of talk to your community and people that love and care about you and your friends about this experience? And what has been sort of the reaction you receive from the people in your networks?
My God. For starters, some of you are love. Some of you are love. You are light. But also some of you are very hateful as well. I've had people coming at me from so many different directions, every left and right. But some of it I also understand, because or I try to understand, because of the fear. Everyone is scared. It's something that they don't know. And as far as this being not an STI, but something that can be passed the way that it is, people are like, why are you telling your business, your sexual business? Yeah, so, and of course the messaging, some of the messaging I've been using is in my mind has been trying to be very strategic, but it doesn't flow with everybody. And that's okay. But I've gotten both good and bad messaging from everything with me telling people. But I've talked to at least 100 people now, as of just messaging me out, just messaging myself, me out, just putting information out, and people was coming to me. But I've talked to so many different people, and the messages are always different.
Well, I just want to appreciate you for being willing to, first of all, be here to share, and also for the work that you're doing just to kind of talk with folks in your networks about your experience. So after you first got the diagnosis and you went home and kind of started experiencing the symptoms, what's been sort of your experience with kind of the sort of the isolation piece, and sort of how are you managing coping with that part of it?
So here's the issue. Though I was tested on July 8th, because I had the first symptom July 7th. By this time, it's like, next early morning, July 8th. I went to the ER because I felt so sick. And I was in the ER for about maybe 16 hours from going back and forth of them, triaging me, taking me back, and then actually having me just sitting in the ER room. And once they saw my rashes, they were like, oh, this is like monkeypox. So immediately they went on and did what they wanted to do to call them and everything. But keep in mind, we have to stress that our ERs are overpacked, that people are overworked. So I was in there for a long time with my symptoms and rash and everything. And also, again, I have to stress the fact that for a lot of people, though you may not have like a bad rash, you may have, if you have an underlying condition, it is, and those symptoms that we mentioned earlier, it is going to increase those symptoms, it's going to multiply them. The backaches, if you have those, the chills, if you have those, it's going to, the diarrhea, if you have IBS, it's going to increase and multiply everything. However, I got tested July 8th. I didn't receive my actual test results because it was over the weekend until Tuesday. So throughout this time, all they told me to do was to go home. And, they did tell me to isolate and quarantine and everything. And because it's in terms of somewhat similar to COVID processes and measures when you're quarantining, I just did what I would normally, do for that. I'm lucky enough to have my mom here. I'm actually in Arkansas currently. And just, it's so funny. I came down here just to visit it, and boom, now I'm sick. But my mom has just been literally, she's been taking care of me through the door. She was taking care of me through the door, and we, wiping everything down, using plastic materials. We have, of course, Lysol. Don't overdo the Lysol. Don't kill yourself with the Lysol. And of course, bleaching. A lot of us already are used to using bleach anyway when we're washing dishes or we're doing anything. So we're just keeping it simple, but just a little bit elevated, but not to the point where, because you have a lot of time in this quarantine to just sit with yourself, to evaluate. My symptoms and my rash spread for 3 days. I don't know how long that is gonna be for people, but mine spread for 3 days. By the time that it spread and did where it was going to be and all over, it kind of just is what it is. So for that time being, I had a chance to just let it sink in that, okay, just whatever. It itch, my God, it itches. It hurts to the touch. It very much, especially when you scrape it or rub it, it's very uncomfortable to sleep. Yes, and then of course it's going to change forms. But I also want to stress for people that because this is very much so, as far as the transmission, how fast the transmission is, in multiple ways of transmission it is very much so COVID-like. It is also not, it's not an STI, but it's in terms of how you're going to feel. It's going to be COVID, but visually, you're going to actually be able to see that, oh my God, hey, you're going through this. I was fortunate enough to only have like a few around my hairline, which are kind of going away, hallelujah. One on my forehead. Of course, once anything gets on our face, we think the whole world is over. And one on the side of my nose. So, but everything else was on the rest of my body. Thankfully, I did not have them on my penis, but I did have them around my butt, which is very uncomfortable and interesting spot. I had one on in terms of the most important parts that really bothered me the most. I had one on my bottom right toe, which was two actually, which was hurt so bad to the point where it hurt to walk almost, like I was walking without a head leg. Yes. I had them in my hair, and I washed my head, and I did not know that I had them in my hair. So, of course, I screamed bloody murder. So, but during those 3 days, that's when it's how long it's going to spread. And after that, once you kind of really figure out or get into the rhythm of, okay, you need to just figure out how you could make yourself a little bit more comfortable, a little bit more at ease. For me, this particular time, I've been taking a lot of time with myself, and I found out I love me. I found out I love me. So for a lot of people, this is gonna be a good time for you to figure that out. Or then some people may be figuring out that they don't like themselves, and it's gonna also weigh on the fact, because yes, things are visual, and then if you're a very vain person, it's going to bother you because you have it on your face, and on top of the itching and the pain. But yeah, it's just I'm kind of realizing that everything is literally it's gonna have its process. As far as the itching, they have not given me anything so far to put on for the itching, and I'm not gonna say that I haven't tried. At least it's definitely in the beginning, but cortisone cortisone did not work. So whatever this is, cortisone did not work. And it usually works for me, but it did not work. I didn't try anything else, and I've heard so many different people, of course, all these different things. However, the doctors have been saying that you really want this to dry out. So if you just find you a way to just be comfortable and let it just do what it's going to do, and eventually you will see that some of the ones that, like they're saying, in terms of it needs to fall off and create new skin. I have legitimately just been chilling, and I've seen one just fall off or move around and looked and said, oh, it's gone. So some of them are done it, but to give you a roundabout of how many I had at least 30. I had it, in every quadrant of my body, I had at least 30 just all over. So for some of them, can't even say half of them, to being able to, progress to the point where we want them to, it's not seeming like they're progressing all at the same time. So, which leads me to that today is officially 2 weeks. I'm 2 weeks in this situation. They originally told me 2 weeks, however, because, all of these have not changed and popped off. It's looking at about maybe another 2 weeks, according to my doctor, because on this particular time, I'm also, with my consent, on the TPOX. Someone else said the name earlier, but I will not be repeating the name, but TPOX. Yes, I'm on that treatment, which is 84 pills. Oh my God, my God. I have always been on a 1-a-day pill for HIV. So taking this many pills is different. It's interesting. However, I gotta do what I gotta do. But take one for the team. Though no one has asked, but take one for the team. But yes, 3 pills twice a day. And today is day 7 of me taking those pills. I cannot confirm nor deny said it, I cannot confirm or deny that the medicine has been working. However, the doctors have been very good about, saying that at least, and so as far as do not touch it, just leave it alone and let it be what it's going to be, and you'll be fine. Again, especially after 3 days, for me at least, you'll know that it actually it's stopping. You will see a change. Outside of a cocoon becomes a butterfly. So just try to think to the bright side of everything.
Absolutely. Well, you're getting a lot of love in the chat, and I just want to offer our appreciation for you coming on and sharing your experience. And we wish you a speedy and swift recovery, and hope to see you back here very soon. So thank you so much. So now what I'm going to do is I want to just quickly turn it over to my colleague Taylor Brown from Georgia Equality, who will kind of give us sort of, I know there's been a lot of interest in sort of what do we do in terms of how do we activate some of the systems that need to be activated for us to improve the situation with respect to vaccine availability. So, so Taylor, I'm going to turn it over to you to kind of give us that charge. And then we will move quickly into trying to get through as many questions as we can. I do acknowledge that we have gone over our allotted time, so I know many people had to drop off, but this is recorded, and so you will be able to get the recording. We'll have an email that will go out with that, along with some other resources that have been shared throughout tonight. So Taylor, the floor is yours.
Thank you for having me, Justin. Can you hear me okay?
Yeah, we can hear you great.
Awesome, thank you. So my name is Taylor Brown. I am the HIV policy organizer with Georgia Equality, and I'm here to give sort of a brief update with where we're at in the organization and what we're able to do and charging for proper vaccine allocation. Georgia Equality and our partner organizations have already begun reaching out to members of Congress, our senators, urging them to make sure more vaccines are allocated to Georgia as soon as possible. We are reaching out to the State Department of Public Health and Governor Kemp, urging them to use some of the $2.4 billion the state has recently just received in COVID funding toward increasing funding for Georgia health departments in order for them to run their monkeypox programs, as well as for them to strategize getting vaccines out and beyond the current metro counties as more doses become available and are allocated to Georgia. Georgia Equality and partner organizations are monitoring the monkeypox outbreaks in the state, and as we place political pressure on our state and legislative delegation, folks here can support by responding to our organization's action alerts and items as they come out in the coming days. We're monitoring this day to day and are trying to stay on top of it as much as possible. And thus, I am placing a link in the chat to our alerts to actions, which also includes a script for writing directly to your congresspersons, urging them regarding the severity of the issue and the need for proper and equitable allocation and distribution of these vaccines across the United States and particularly to Georgia. So let me place that in the chat at one moment. And that is more or less the update from Georgia Equality. Thank you for having me, Justin.
All right, well, thank you so much for that. So that's a really important ask to have out there. I think one of the things that we want to make sure that people come away from this is that, if we had more vaccine available, we could quickly solve some of the issues that people are having with actually getting appointments for vaccination. So the issue is how do we increase the supply? And so using our voices to connect with our elected officials to get that release from the federal government, I think will be helpful. So thank you, Taylor, for that ask. And so if folks want to jump in the chat, you'll see that link there to the Georgia Equality Action Alert, which has a script that you can use to send off some messages to our electeds and let them know how they can help us address the monkeypox outbreak here in Georgia. So thanks for that. So we're over time, but I do want to answer a couple of the questions that have been submitted. So I want to just go through some of these questions. And I think, Joshua, I think a lot of these will be for you, and just trying to get some more clarity about the process for how people can sign up for vaccination events when they come online. I know you mentioned that there were a couple events coming up in the future. Is there a place where people can sort of get access to that information? Because I know that I certainly wasn't able to hold all those dates. So where can people kind of go to learn about how to sign up, and how can they learn about when these events are coming? I think that's kind of the most cited question in the chat. So
yeah, that's a great question. So again, we usually find out how many vaccinations we get or how many vaccines we get each week on a Wednesday. So we prepare our event after that. So usually it's been Thursdays that we open registration. Like I said, we're trying to blast out on our social media. So we have Facebook, Instagram, and Twitter, where you will see some of those announcements of when registration will open. And I'm pretty sure that the other Board of Health through metro area Atlanta also do the same thing. So check out DeKalb's socials, Gwinnett's socials, and Cobb and Douglas. Again, I think it's highly problematic that people need to have access to technology in order to get that. So if you work or you're connected with a community-based organization for services and support, then you might check with people in those spaces, especially we're working closely with folks like A Vision for Hope and Someone Cares and NASM, Thrive SS, who's represented here, and they are centering the folks in their communities that also have been, most, I think the folks that, for whatever given reason, I don't want to ask their histories, right? I don't necessarily need to know, but they know their people well enough to know how to build those lists. And so we're getting wait lists from them as well. You'll see vaccinations happening through other agencies. So someone said, we're going to push these out through like the VA, through Emory, through Grady, infectious disease. There are places where people are accessing services. Make sure that you demand that you get not only monkeypox testing there, but also that vaccines are available in a place where you access your services, right? They need to know that there's a demand there. We're also, in some of the data that we're collecting, finding out individuals who had sexual history stuff. So again, potentially the last 3 months exposure to chlamydia or gonorrhea or syphilis is pretty high amongst the folks that have monkeypox. So like places where sexual health screenings occur, we are trying to, the community-based organizations where people access services outside of the ones that I mentioned we're asking those questions when we do our interviews so that we can find out, and then where the best places to get vaxes out to people are. And then finally, some of the social spaces that we're talking about, bathhouses, sex spaces, parties, events, you will see vaccinations rolled out there as well. So we're coordinating with that. The thing is with Fulton County, because we've had such a limited amount of number, we just wanted to blast them out as quickly as possible in a way that we were trying to be equitable. But as we get more and more, we're having plans and collaborations in place so that they can be distributed more evenly and not just held by us.
Thank you, Joshua. So I've got a couple of clinical questions. So these would be directed to either Dr. Folks or Dr. Thompson. And so there are a couple of questions around kind of transmission routes. And so there's a question about is transmission via large respiratory droplets only possible if you have lesions in the mouth? And questions around, is there anything that's a distinguishing feature of a monkeypox lesion compared to other kind of more common skin lesions? And then while you're on here, I have a couple questions of people asking about for folks that received the smallpox vaccine kind of back in the day, if they still might have protection against monkeypox now. So there's a couple questions around that. So I don't know who wants to take either of those.
Well, I'll jump in and first of all say that it is having respiratory droplets that have virus in them is not dependent upon having sores in your mouth, apparently. So, but it does require fairly close face-to-face contact for a period of time. So it's not the kind of thing that you're going to get it from somebody breathing across the room or whatever. They're really larger droplets, but it's not dependent on mouth sores. And then the question about, there were many questions that I saw. Well, I got vaccinated when I was little, and now I'm not so little, and do I still have immunity, and all that stuff. And so I have to say, I'll give you a qualified answer about this, and I think we will probably learn more about this as this epidemic goes on. But some of the immunologists at the National Institute for Aging have said that that protection or antibody titers have been very high, even in older people, from smallpox vaccine. You have to remember that smallpox vaccine is one of our most effective, powerful vaccines. As was mentioned, it eliminated smallpox, and that doesn't happen very often. But apparently, even older people do have fairly high titers of antibodies. Now, does that mean that those antibodies will protect you against getting infected? I think the thinking right now is that some protection is offered, and that if you get monkeypox, it may not prevent you from getting an infection, just like a COVID vaccine may not prevent you from getting an infection with COVID, but it's likely to make the disease a whole lot less severe. So having a distant smallpox infection may indeed make your actual clinical experience much less severe. Or it may prevent it entirely, but I wouldn't be cavalier about it and say, oh yeah, I got my smallpox vaccine when I was 5 and now I'm, 65. So, woohoo, let's go for it. I don't think you can be that sure about it at this point. And I would say that if you are identified as a contact for someone who has had monkeypox, so you actually have been exposed, you know that you have been exposed, there are some recommendations that if you haven't had a smallpox vaccine within 3 years, you should get vaccinated. David, I'll leave the rest for you.
Hi, so one of the questions that, if I'm not mistaken, Justin had posed was how do we differentiate some of these lesions in particular from other skin conditions? The monkeypox lesions have a tendency to present in a multiplicity of ways. It may present as spots initially, but these lesions change over time. So you find that these spots begin to grow when it forms a firm bump, then a fluid-filled bump that may, the content may be clear, but then it starts to get yellow. And then of course, one of the characteristics about these pox-like presentations is that there's a small sink in the top of the bump once it starts to get soft. So after that point, those bumps tend to ulcerate. So you have an area of raw skin, and then of course crusting, and those scabs tend to fall off afterwards. So it goes through a number of stages. We can classify them into 6 stages. So depending on what stage it is in, it may look different from other skin conditions. Also, the distribution of the lesions is very important to take into account. Historically, we have seen where monkeypox has what we've called a centrifugal distribution. That is to say that the lesions have a tendency to be on hands, feet, and head in a greater concentration than it would be at the center of the body. However, in this case, in the 2022 outbreak, we're seeing where it's presenting as well on genital regions, on perianal regions, and we're seeing where it may not necessarily be that intense, very florid type of presentation where we're seeing all these like a lot of lesions, it might be much less. For example, Antonius had mentioned he had only 30 lesions, which I'm pretty sure is not what we're seeing in some of the images that we're seeing online when we look at this. So that's very important to take into account. And of course, you have a lot of other skin conditions that are known to be great simulators, like syphilis, for example, which may present in a number of ways. But syphilis generally does not present with fluid-filled lesions. So that's one of the very distinctive factors. And generally, syphilis, the initial lesion presents with an ulcer. So of course, it's going to differentiate, without going too much into syphilis or going too much into other illnesses. It has its own characteristics, that as well as the other symptoms that accompany it. For example, the swollen lymph nodes are telltale signs that this could be monkeypox.
I would just tag on to that, it's usually not just one lesion. It's not just one sore. So it might start with a sore. You might notice, oh, maybe that's a mosquito bite or whatever, but then there's another one, and then there are 5 more, and then they're all over the place. So it is something that once it starts, tends to sort of rapidly progress. So, that's different too, from most diseases that cause rashes.
Also, just want to add that I had never actually heard someone explain literally what I felt and saw. I just want to know, you just re-traumatized me all over again. Because literally, you just walk through the whole progression of the whole time. Because, so that being said, try not to look at it. Because you will see that, and it looks like something off of Resident Evil. It's very ugly. Also, to add that to people, again, the underlying conditions is going to make things flare up. Just for forewarn you, if you ain't on your meds, or if you've been holding off on your backache, your pain ache medication, you're not going to hold off on it this time. If you've been holding off on your blood pressure, all that medication that you should be taking, you're not going to hold off on it this time. You're going to be fiending for that particular medication. And specifically for people also who have dual diagnoses, if you are HIV positive and you also have herpes as well. I'll keep it real, I have herpes as well. So when I had this flare up, along with the IBS flare up, along with and also a herpes flare up as well, everything is just went haywire until the time that it wants to stop. So take care of yourselves.
Thank you for that. I want to just acknowledge the time. I know we have gone well over our allotted hour for this, but I think that speaks to just the interest and the questions that folks have in the community. So I want to say a couple things, and then I will take a couple more questions before we close out. We're hoping to be able to do this again, and may have a different sort of cast of characters. We might kind of host it with a different organization. We know we want to make sure that we're doing stuff in other languages in particular. And so I think this will not be the only conversation that we have about this. So I know folks have lots and lots of questions. So I just want to acknowledge that we see that. We will work to get the questions answered and shared out. This is recorded, so we will also share out the recording. So just know that this is not the last conversation that will happen in Atlanta about monkeypox. So I just wanted to kind of frame that up. But I'll take a couple more questions here. And, so I think this is something that we sort of touched upon earlier, but I think it might be helpful, particularly as we're still kind of in this space of sort of scarcity of vaccine. And I'm just wondering if you could kind of lift up, Joshua, you gave some great examples, but I'm wondering if other folks have other thoughts around sort of other harm reduction steps that people might be able to take while they're sort of waiting in queue to be vaccinated. And another question for our medical colleagues is, there's a couple questions around sort of how long it takes for the vaccine to sort of reach full efficacy. So like how long after kind of the second dose are you considered kind of fully vaccinated if we're using kind of the COVID framework, or does that not even sort of apply to this? So, so first, what kind of harm reduction steps might people take? And two, what are some of the things in terms of the time between your final dose of the Jynneos and sort of when you're considered fully vaccinated. So Joshua, you put your hand up first. So
yeah, I mean, I have a few more now that I've had the chance to think about it. So I want to recognize that different districts are doing it differently. And so San Francisco is somewhat conservative, and my pals there are limiting hugs, especially when you're at the club and shirtless, the ways that we embrace folks, especially when we are enjoying a party experience, potentially with the support of substances, and the embraces that you get instead of handshakes, it's fist bumps. There's conversations in Berlin about the transmissibility on surfaces in bathhouses and saunas, potentially gyms. I don't think we're seeing trends of that, but it doesn't mean that we should rule that out. I would also say washing bedding after hookups, the ways in which like you're sharing bedding spaces with sleepovers and folks that even are just friends, because as we're seeing, you know, if our peers and lovers and friends are in our same circles and are potentially exposed, then being in those spaces, wearing their clothes, those can often transmit. So just limiting sort of the ways in which we're exposed to things that other peers might also be exposed to are a few harm reduction techniques that I've heard about.
thank you. And then just the question around the kind of being fully vaccinated.
Okay, so I can take that one. So when we're talking about that time between vaccination and full immunity, we have to take into consideration that there are two different vaccines available. The most widely available one right now is the Jynneos vaccine, and people are considered to reach maximum immunity 2 weeks or 14 days after receiving their second dose. So you have your first dose, your second dose 4 weeks after, and then 2 weeks after that second dose, you have that maximum immunity level. But when we're talking about the ACAM 2000 vaccine, we're looking at 4 weeks from that first dose. This is a single dose vaccine. So 4 weeks after that first dose, you're considered to reach maximum immunity.
Great. Hey, well, I will just turn it over to our panelists to see if they have any sort of closing comments that they want to offer us as we close out for tonight. And know that there are, we have a bunch of questions. We will get answers to those and send that out.
Yes.
But I know that we have gone well beyond our allotted time. So I want to be respectful of panelists and sort of the time that they spent with us. So we'll just kind of go in the order in which people presented. So I'll turn it over to you, Dr. Thompson, for any kind of closing comments you want to offer the community here.
So I just want to quickly answer a question about the treatment, TPOXX, because there were a number of questions there. TPOXX is the treatment, and any medical provider can get it. Requires a good bit of paperwork. You can only get it from CDC because it is investigational. But it is available mostly for people who are having more severe symptoms. But I just want to close by telling people that I think this is a real opportunity. We've done a terrible job with equity on these other pandemics we've been through. Let's not make those same mistakes. Let's work together as a community. We have incredible power as a community. We need to use our voices. We need to advocate, and we are being listened to. So CDC has made a number of changes because of the feedback they have gotten. So, we need to be vocal, and we need to advocate, and we need to stand together as a community and really respect our public health folks who are doing the best they can in a really terrible situation. So thanks everybody for coming tonight, and happy to answer questions for people by email if you have them.
Thank you, Dr. Thompson. Dr. Folks.
Just want to say thank you so much for having me. It's very important that we understand that, as Dr. Thompson said, we have learned, the authorities have learned, the CDC has learned. So I noticed that there have been a lot of comments and a lot of concerns about communities of color and particular persons who may find themselves being minorities in this great America that we live in. And so we want to ensure that everyone is vaccinated. We want to ensure that everyone is receiving the information. Huge shout out to Fulton County Board of Health and other other boards of health, the CAB Board of Health. They've been working with our community-based organizations to ensure that our communities of color are definitely receiving the information, but also being provided with the resources to ensure that people get vaccinated, that people are aware of what's going on, that people are aware of the epidata. So huge shout out to you guys for providing us with that information. And of course, you know that if you need any information or any assistance with accessing vaccines or accessing vaccine information or general information on monkeypox, we are here for you at Thrive SS. We also provide linkage to care for persons who are living with HIV and also prevention services. So as Dr. Thompson had mentioned, those are some of the elements that do factor in. Viral suppression is key for those who are living with HIV. So it's a very good time for you to get tested, ensure that you're aware of your status. And if you are aware of your status, to ensure that you're on those medications and getting virally suppressed. So you can feel free to reach out to us. You can reach out to me via email. I'll leave my email in the chat. So you guys can reach out and just ensure that you are getting the information that you need.
Thank you, Dr. Folks. Joshua.
I mean, I just want to thank everybody who is involved in organizing on behalf of our community. And I encourage folks that are in this space to do so for their own peers and friends and sexual and social networks. I think we need to show up hard for each other, because clearly we can't expect other people, especially in government systems, to do that for us. Though I'm part of a government system, I'm also part of this community, and we're activists and we're trying our best. I'm going to keep working through it. I have a lot of lessons learned. I will put my contact in the chat for people to reach out. I will say that I have been overwhelmed and inundated with emails this week, so please be patient in my responses, especially community-based, because there's only so much I could do and only so much information I have. I have learned as much about monkeypox. This is as new to me as everyone else in this space. You know, it's only been 3 or 4 weeks that this has been on our radar and that we've been tasked to doing this. I did not sign up to be a monkeypox expert, nor did I sign up for this role to run monkeypox vaccination clinics. This is on top of my job running a full sexual health and HIV program. So I'm here for it. I'm here for feedback. We are constantly changing and making adjustments accordingly. And I'm reading, taking notes from folks that have made comments in the chat, especially around how we post, the ways that we post links. So keep that coming, because I think we can only get better. And we're just know that we're committed to it. So thanks, everyone.
Thank you so much, Joshua. Antonius, any closing comments from you?
Yes. So everyone, I don't know about you all, but not everyone has a whole month or 30 days worth of sick leave. And even if you do have that, who wants to use it? And you definitely don't want to use the vacation time as well. So I just urge everyone to follow everyone has a department that handles their benefits, their insurance and everything. Just urge you to follow and figure out what that process is for your company, because all agencies have but it's different. Everyone has to do something very much so different. So just follow the proper channels, do what you need to do in order to protect yourself. It doesn't matter how cool or you are with your manager or however you think that you don't need to do it. You still need to do it in order to protect yourself. Figure out what the proper follow the proper channels and everything. Also know that yes, while you're scared, but you still it's okay to give yourself grace. It's also okay to give your managers and everybody grace as well. Not too much grace, because you still want to make sure you're doing what you can do to protect yourself, you and your jobs. And that there are ways to protect ourselves and everything. Also, the American Disabilities Act, please, if you're not familiar with the American Disabilities Act, please look up on it and read up on that. Thank you.
Thank you. And I just want to close and just give a big thank you to all of the partnering organizations that put tonight's event together. So big shout out to the Atlanta Pride Committee, to the Mayor's Office of LGBTQ Affairs, to the Fulton County Board of Health, to Georgia Equality, to Thrive SS, and to Positive Impact Health Centers, my employer. This will not be the last conversation that we have. So I encourage you to kind of follow all of the partner organizations on their various kind of social media accounts. you'll see more information about future conversations about monkeypox in this kind of town hall format. You'll also find information through the county health departments about those all-important vaccination signups. And so that's all I've got for tonight. And thank you all for being so generous with your time and your attention. I know you have many other things that you could be doing with Thursday night, but you chose to be here and to learn about monkeypox, which says that you care about our community, and that means a lot. So we will all get through this together as a community. Have a great night, everyone.
Thanks, Justin, for hosting.
Thank you so much. Y para las personas de habla hispana, fíjate que vamos a tener otro evento de habla hispana para que ustedes puedan tener información también.
Esto, bien pronto. Ojalá en como 2 semanas, más o menos. Nos vemos allí.
Más o
Thank you,
menos.
Justin. Beautiful job.
Thank you all. Have a good night.
Bye, everyone. Thank you so much.